Good day, everybody. My name is Delma Stubbs. I'm with the Mahoning County Veterans Service Commission. I am the outreach coordinator. And today we're going to talk about a program that we're going to be working with Mercy Health for free dental care for veterans. So this is about dental care and you, the veterans. I don't want to live in a kind of world where we don't look out for each other. Not just the people that are close to us, but anybody who needs a helping hand. And I can't change anybody else's way of thinking or what they choose to do, but I can do my bit. And when Dr. Beck came and talked to me about doing a presentation for approximately 25 dentists and saying that they will provide dental care for veterans because, as you will see in the slide from now, that dental care is limited to veterans. They open up a door of opportunity, not only for dental care for veterans, but for veterans' overall health. So the VA dental care is limited to many veterans, and the veterans dental care is limited to those who fall into one of the following groups. So if a service member has a VA service connected compensable disability or dental condition, they are eligible for any dental care. Those veterans who were prisoners of war are eligible for 100% dental care. Veterans that are participating in a VA vocational rehabilitation program, Chapter 31, are eligible for dental care necessary to enter into a rehabilitation program, achieve the goals of the Veterans Vocational Rehabilitation Program, or prevent interruption of the rehabilitation program. Veterans with service-connected non-compensable dental condition or disability who serve on active duty for 90 days or more, who apply for veterans dental care within 180 days of separation from active duty, may receive a one-time treatment for dental conditions if the dental condition is shown to have existed at the time of discharge or release from the service, and the veteran certificate of discharge does not indicate that the veteran received necessary dental care within 90-day period prior to discharge or release. Those having service-connected non-compensable dental condition or disability resulting from combat wounds or service trauma are eligible for repeat care for service-connected conditions. Those having dental conditions clinically determined by the VA to be currently aggravating a service-connected medical condition are eligible for dental care. Those with non-service connected dental conditions or disabilities for which treatment was begun while the veteran was in inpatient status in the VA medical center, and it is clinically determined to be necessary to complete such dental treatment on an outpatient basis. Those receiving outpatient care or scheduled for inpatient care may receive veterans dental care if the dental condition is clinically determined to be complicating a current medical condition currently being treated by the VA. And last but not least, those veterans that are in a veterans homeless program for 60 consecutive days may receive certain medically necessary outpatient dental services. Reasons why dental care goes untreated. One is affordability. 33% of people skip dental care or routine checkups because they couldn't afford it. 1 in 4 Americans don't have dental coverage currently, and some have no dental insurance at all. The Affordable Care Act made dental care a required benefit for children insurance, but didn't extend those benefits of insurance for adults. So therefore, again, many adults don't have dental coverage. And not all veterans are covered under VA dental care, as we previously discussed. Oral care and the veteran. Just wanted to state these facts about overall health and wellness. Tooth decay is 5 times more common than asthma and 7 times more common than hay fever. Tooth decay affects 90% of U.S. adults in the U.S. over age of 40. Dental disease has been linked to heart disease and other mental health diseases such as dementia. Dental disease affects the health and well-being throughout life. And tooth loss can affect basic functions such as swallowing, chewing, speaking, as well as face shape and self-esteem. Improper dental care can lead to cavities and can cause more serious health problems, which we will discuss in the upcoming slides. We have to remember that the mouth is a gateway to the body. And when we consume things, the adage was that we are of what we eat. Everything goes through our orifice, our mouth, and it goes straight to our stomach and then into our bloodstream. So it can affect other organs or other parts of the body. So oral related diseases that can have effect on your overall health and which is associated with systemic disease which affects other illnesses and organs include diabetes, heart disease, leukemia, kidney disease, oral cancer, and pancreatic cancer. As we discussed previously, that oral care is a pathway and has direct effects on other illnesses and injuries. When we talk about systemic illness, the oral cavity is the gateway to the human body. Research conducted has medical evidence that people with dental related issues can have devastating effects on one's heart, lung function, and susceptibility to strokes. We are going to briefly talk about a few of these illnesses, including diabetes, heart disease, pulmonary, lung functions, and other respiratory illness to include pneumonia. Heart disease is the number one killer in men and women and throughout the United States. And studies have shown that bacteria or germs from other parts of your body, such as from the mouth, can spread through your bloodstream and affect those vital organs. The Journal of Periodontology warns that gum disease could cause you to get infections in your lungs, including pneumonia. Here are 2 cases where a dental problem was not addressed. Where in Cincinnati, a 24-year-old father died from an infected tooth because he couldn't afford the antibiotics he needed to treat the tooth infection. The antibiotics cost approximately $58. The painkillers cost $12. So he chose to treat the symptoms instead of the illness, the pain instead of the infection, and he later succumbed to septicism. In 2007, an uninsured 12-year-old died when bacteria from an abscessed tooth traveled to his brain. The tooth extraction would have cost $80, but in essence, his final medical bills totaled over $250 after being treated in the hospital. What are we doing? We here at the Veterans Service Commission have teamed up with Mercy Health and the Kinko Mobile Dental Clinic. They will be on location for veterans starting February the 6th through December 2020. Dental care for veterans will take place on the first Thursday of every month for periodic cleaning, extractions, other dental services, denture cleaning and care. And if there's a veteran that comes in with severe problems, he will be outsourced or given an appointment at their home clinic. The van will be located behind the parking deck at 345 Oak Hill. There are limited appointments, so first come, first serve by appointment. There is the link in the PowerPoint slide, and I will provide the link also in a short narrative at the bottom of this video. I want you to be patient, and if we have conflicts with the time, we may have to adjust appointment times as necessary. We are the first to do something like this, and we have your best interest in mind. So we all have to work together. Appointments are open for scheduling, and when we are full, we will call you, text you, or email you to confirm or advise of the schedule if the schedule need to be changed, or if we have an overbooking of a certain time. The program again will run first Thursday of the month until December 2020. If you have any questions, you can feel free to contact the Mahoning County Veterans Service Commission at 330-740-2450 and talk to the Veterans Outreach Coordinator. This is the location where the dental van will be, at the back of the parking deck at 345 Oak Hill. The street is Ridge Avenue, and appointments will start at 08:45. They will be an hour long up to 13:45. 13:45 will be the last appointment that can be made for the day. These are some of the resources cited in compiling this information to educate those veterans in the community about the importance of oral care. And if you had any questions or you want to do some research for yourself, here are a few places that you can start. Oral health and overall health, and that's why a healthy mouth is good for you and your body. Researchers are also discovering new ways for good oral care, one of which is through regular cleaning and checkups, which can help ward off medical disorders. Through those, especially if you have gum disease, may increase a person's risk for serious health problems, as we discussed, such as heart attacks, strokes, and poorly controlled diabetes. What's in your mouth reveals much about a person's health. And the healthiness of your mouth have to do with your overall health. A look inside a swab of saliva can tell you and tell your doctors volumes about what's going on inside your body. Working with Dr. Beck, the Kinkle Dental Van, and the people at Mercy Health, and you, the veterans, we hope that we will have an impact and are able to help many veterans within the community. This program is not only for Mahoning County veterans, but extends to veterans across the state of Ohio. With limited appointments, we have to make sure that we are able to service many of those that may call in. So again, please be patient, and thank you for taking the time to listen. Please pass this video on to other veterans. Pass the link on so we can help veterans in our community. Thank you very much, everybody. Have a good evening.